Well, I hit my first DLI. You could see here in the picture right here, my patient's really struggling to bring that right lower lip down. But before we dive into why this happened, let's go through a brief anatomy review. We have three muscles that could be playing a role in this. Number one, we have the DAO, or the depressor anguli oris, which is a triangular muscle that sits in the lateral part of the chin. Now, this muscle originates on the mandible and it inserts into the corner of the mouth. So its function is to lower the corners of the mouth. Just medial to the DAO, we have the DLI, or the depressor labii inferioris. Now, this muscle overlaps with the DAO and it lies just deep to the DAO. It overlaps the most closer to the mandible, and the function of the DLI is to bring the lip down and outward. So it really helps with eversion of that lower lip and it helps expose those lower teeth. Now, even more medial to the DLI lives the mentalis. The mentalis is our chin muscle. The origin of this muscle, it originates on the incisor fossa and it inserts into the skin of the chin. That's why we start to experience that dimpling as we age. Now, the function of this muscle is really to support that lower lip. So let's bring it back to my patient. I originally injected both her DAO and her mentalis. Why? She was experiencing a downturned smile. So by releasing the pressure, remember that DAO impacts the pulling of the corners of the mouth down. So if we can relax it with a little bit of neurotoxin, we release that pressure and you get a little upturn in the corners of the mouth. So I injected her DAOs. I typically inject with a 2-point injection technique. I typically look for that pucker right, let's see, right there. That pucker, I'll go superficially with 2.5 units, and then I'll draw a diagonal line straight down from the oral commissure all the way down through that pucker to the mandible, and I'll inject an additional 2.5 units. I like to get it at the origin and then upward near the insertion. That's just my preference. Everybody skins a cat differently, right? So 2.5 units makes it 5 units each side. And then I injected 6 units in her mentalis with a classic like triangular point. So 1, 2, 3. More superficial, just 6 units right there. Now, what likely happened, and we don't know, is some of that neurotoxin bled into her right DLI. How do I know that it was the right DLI that was impacted and not the left? It can be a little bit confusing. The reason I know it was the right DLI is because she can't pull it down. Remember, the function of that DLI is to pull down and out that lower lip. So if you can't do that, your smile looks like this. You can't draw it down, right? You can't bring that lower lip down. So I know that that function was paralyzed with however many units of tox. Now, how do we treat this? We know that some neurotoxin got in there, but we don't know how much. So really there are three options when it comes to treating our patients with this. Number one, you could do nothing. You can let it ride, watch and wait, and eventually it will fade because neurotoxin, as we know, is temporary. Number two, you can inject with more neurotoxin the opposite DLI and kind of help block that function. And number three, you can use Upneek, which is oxymetazoline. You can place it in the lower lip and see if it helps that. You can also use Upneek with any of the other treatment options. Here's how I break down what to do. Number one is watch and wait, right? In my thought process, this is what we ultimately ended up doing for my patient. We're watching and waiting. She's currently experiencing it. It's been, I want to say, week 3. It has softened, but it's still very much present. So watch and wait. Why did I choose that? Because I don't know how many units truly bled or spread into that DLI. It could have been 1 unit that's holding on. It could have been 2, 3. I don't know how many units was actually impacting the DLI that's impacted. If I were to go on the other side and truly target the DLI with concentrated units, then I may have an issue where the originally impacted side or affected side improves and completely resolves. And now you targeted the contralateral DLI, and that's going to last even longer. So, my thought process, and everybody has their way of trying to troubleshoot this, right? There's no wrong answer. I chose to watch and wait with my patient because I don't know how many units got into that affected DLI, and I rather just ride it out than put concentrated, clear units in the unaffected DLI. It's unfortunate, but the patient was on board with that thought process. You can also use option number 3 in conjunction with your other treatments or options, which is upneek or oxymetazoline. Upneek is an alpha adrenergic agonist. That was really hard to say. But so it doesn't improve muscle movement, but it can tighten smooth muscle and soft tissue. When applied to the lower lip mucosa of the affected side, it can increase tone and basically give the lip more support and soften the appearance of the asymmetry at rest while that DLI is kind of regaining its function. So in theory, we have 3 options: watch and wait, inject the other DLI, and offer upneek. So here's the honest truth. Hitting the DLI can happen. I'm actually surprised all the years I've been injecting that I haven't hit a DLI yet. Even with the most precise injections and incredible anatomy understanding, it can happen. Everybody's anatomy is a little bit different. And neurotoxin is a very thin liquid, so it can diffuse into nearby muscles. It's important to keep your reconstitution pretty tight with lower face neurotoxin injections just to kind of prevent that spread of effect, but these things can happen. What's really important is that my patient understood the risk that she was taking with these injections. Anytime I'm injecting the DAO or the mentalis, I inform them that there is a risk of a muscle that lives nearby being impacted. And when she came back to the office or messaged me, she was well informed. She understood the risk and she was like, unfortunately, what we talked about happened. And that is such a great place to be in as a provider. My patient was well informed and the complication unfortunately did happen. So, my only recommendation is these things are going to happen, but make sure that you educate your patient on the potential complications. That's going to ensure a great patient experience for your patient. So if you loved this video, please hit that subscribe button, comment below with any other topics you want me to talk about, and I'm happy to.